This segment of the discussion of today, how to interpret nephropathology report. Injury localization for the compartment of the kidney, either glomerular, vascular, or tubulointerstitial. Category of injury, active versus fibrosing or chronic. Types of lesion. Determination of the nature and the pathogenesis of the lesion. For the native kidney specific lesion, either glomerular lesion, vascular lesion, or tubulointerstitial lesion. For the transplanted kidney, the same. We have either glomerular, vascular, or tubulointerstitial. Estimation of the percent of affected glomeruli in the kidney is similarly subject to sampling error, like distinction between more than 50% and less than 50%. Distribution of lesion is not random in some diseases like FSGS, focal segmental glomerulosclerosis. Option when inadequacy have occurred. Reprocessed paraffin or frozen block for EM or frozen for paraffin. Immunohistochemistry for immunoglobulin in paraffin block. Scoring system and the definition described by several classification systems. For example, for lupus nephritis, we're reporting through according to the International Society of Nephrology, Renal Pathology Society. For the IgA, we use the Oxford classification system. For transplant biopsy, we use the Banff scoring system. Complex biopsy, more than one disease may be present, common in allograft. Residue from past disease persist. Functional interrelationships, disease of one component may affect another. Loss of glomeruli affect blood supply of tubules. Vascular disease affect tubules and glomeruli. Reporting recommendation, diagnosis include severity and activity whenever possible. Use current classification system for particular disease like lupus or diabetes or transplant. Reporting recommendation, description, indicate sample number of cores, cortex or medulla or corticomedullary junction present or no. For the glomeruli, we should we included this the upcoming lesion. For the glomeruli, count number in sample, can count section with greatest number, give the percent of global or segmental sclerotic glomeruli, mesangial cellularity, thickening of capillary wall or glomerular basement membrane, presence or absence of the following items: inflammation, necrosis, crescent, thrombi, adhesion, hyaline, periglomerular fibrosis. Indicate fraction of glomeruli involved, useful to give the percent of normal glomeruli. This is the normal, this is the histology of normal glomerulus as I described before. We have here the Bowman's capsule, and this is the glomerular tuft. This pink thing is the mesangial, and this is capillaries are capillary lumen. This is the section stained by PAS stain, as we know from this highlighting of the Bowman's capsule, Bowman's basement membrane, and the tubular basement membrane is highlighted by the pus stain, and this is a section from an artery with the endothelial lining here and the smooth muscle of the arterial wall here. For the glomeruli, we count the percent of globally or segmentally sclerosed glomeruli. This glomerulus, this is the tuft, is patent everywhere, so we don't have any sclerosis for this glomerulus. For this one, we have just early mesangial thickening here and here that highlighted by the BS stain, just mesangial thickening, no sclerosis here. For this glomerulus, we have different pattern. This is a segment of mesangial expansion and sclerosis starting here. This segment is less than 50% of the core, so this is segmental mesangial sclerosis. For here, We have the sclerosis more than the previous example involving all this area. We're looking here, the tuft have this patent capillary here, but in the sclerosed area, it is the capillary lumen were occluded or disappeared. For this, another example of segmental sclerosis, this is a segment of the glomerular sclerosed here, and here this is a global sclerosed glomerulus. So this is segmental compared to global sclerosis. This is another example for segmental sclerosis here. But this example have adhesion to the Bowman's capsule. The Bowman's space that was patent, should be patent here in the glomerulus, is obliterated here. So sclerosis with adhesion to the capsule. This is another example of segmental sclerosis involving more than half of this glomerulus. This is example of global sclerosis or total sclerosed glomerulus. Next item in the renal pathology lesion, we have the comment on the mesangial cellularity. This is an example of normal cellular glomerulus. The cellularity here is normal. If we notice for this segment and this segment, we notice that here there is increased in the mesangial cellularity here and here and here. If we notice to this glomerulus regarding the cellularity, we notice here this is marked increased in cellularity that obscuring the glomerular capillary. The glomerular capillary about to disappear from the mesangial expansion and the increased cellularity. Same. Next item, presence of inflammation, necrosis, thrombi, or crescent. If we notice for this glomerulus, inside the capillary lumen, we notice the presence of intracapillary increased cellularity of leukocyte, presence of leukocyte inside the capillary lumen. And this is example for necrosis, glomerular necrosis. The tuft is undergo necrosis. This is example for the thrombi. Here, this is capillary lumen involved by this big hyaline thrombus. And this is example for the crescent. This glomerulus involved by this crescent at involving most of this glomerular capillary, and the tuft is restricted to this small area. So this is a cellular crescent. Next item in the lesion of the kidney is the capillary wall or glomerular basement membrane thickening. If you notice this, if you consider this is maybe normal normal thickness of the capillary wall, if we notice here, we notice that this is capillary wall is thickened here. Another example that we have all the tuft is studied for remarkable for thickened glomerular basement membrane. Presence or absence of inflammation, necrosis, crescent, thrombi, adhesion, hyaline periglomerular fibrosis. This is crescent also. And this is a leukocyte inside intracapillary inflammation. And this is, we have here, this Bowman's capsule at this side is normal, but in the other side here is studied for periglomerular fibrosis at this side. This is regarding the glomerular lesion. For tubular lesion, we have what are the diseases involving the renal tubules? The tubules may be involved by acute injury, necrosis, atrophy, presence of cast, and the types of cast is different, while red blood cell cast, protein cast, pigmented cast, or neutrophilic cast. Tubular reabsorption droplet or vacuolization, vacuolization or nuclear inclusion and giant mitochondria. We measure the percent of everything. For this section of the renal tubule stained by the PAS stain, we notice here that tubule is patent with normal lumen, and this is a PAS stain, and the tubule is back to back, and no abnormalities is noticed here. For this photo, we have atrophy starting at this smaller tubule with thickened basement membrane and narrowed lumen. So here we have atrophy involved with these renal tubules, while the other is spared. This is another example for tubular atrophy. The tubule gets smaller than in size and have rough and thickened glomerular basement membrane and irregular outline if compared by these normal renal tubules. Another example for the tubular atrophy. Here the tubular atrophy make obliteration of the lumen with very thick and rough basement membrane as compared to the normal renal tubule here. This is regarding the tubular lesion. For the interstitium could be involved by inflammation, and for this we comment on type of cells, presence or absence of granuloma. The other element involved for the interstitium is the presence of fibrosis. We measure the pattern and the extent and the percent of the fibrosis if present. Interstitium inflammation type of cells. For this example, we have notice here that the interstitial compartment is extended by the presence of this inflammatory infiltrate. We could comment for this amount of inflammation as mild, that involved more than 10% but less than 25% of the interstitial compartment. This is another example, and we notice here the amount of interstitial inflammation is more in amount than the previous one. Here, this is more marked inflammatory response at the interstitial compartment. Second item after inflammation is the presence or absence of fibrosis and the extent and the percent of fibrosis if present. Here, this is Mason trichrome stain. We notice here that is in expansion of the interstitial compartment. The tubules are separated from each other, but no staining for blue color here. So this is interstitial edema, but not there is no interstitial fibrosis. Here we have very mild amount of blue color, so here is mild interstitial fibrosis. Here the blue color is increasing, so the percent of interstitial fibrosis is more apparent here. This pattern of fibrosis we have, this is called skipped fibrosis, so area involved by fibrosis and the other is spared. So this is stripped fibrosis. This is regarding the interstitial compartment. Regarding the arteries or the vascular compartment of the kidney, we count the arteries present in the biopsy. We examine the arteries for intimal fibrosis, arterial hyalinization, vasculitis, or peritubular capillaritis. Immunofluorescence indicates the number of glomeruli in the sample, given pattern and the intensity of glomerular staining through a score of 0 to 4. Note other relevant staining like staining of the tubular basement membrane. And this is staining of complement C3 in the case of lupus nephritis. Electron microscopy include number of glomeruli, status of podocyte, if there is effacement or hypertrophy, glomerular basement membrane thickness, lamination or deposit, extent and position of the deposit. We also comment on substructure of any and dimension, mesangial features like fibrils or cells or deposit. This photomicrograph, this is of a normal capillary lumen of one capillary. This is podocyte here is patent. And this is endothelial cells, and this is a capillary lumen, and no abnormality. This is the normal capillary basement membrane. This is the basement membrane, and this is of normal feature. This is a case of minimal change disease. We have noticed here that the podocytes are effaced, not patent like the previous normal one, but effaced here. This is a case of where the subepithelial deposits are noticed here. This is black things are subepithelial deposit. This is fibrils of amyloid that are described as non-branched fibers ranging size from 8 to 12 nanometer. In summary, compare with previous biopsy if any link to clinical information, discuss differential and the basis of conclusion, types of lesion for the native kidney specific lesion, glomerular lesion like thickened glomerular basement membrane, thin glomerular basement membrane by EM, proliferation, sclerosis, crescent, unusual lesion or rare disease. A vascular lesion, sclerosis, thrombotic lesion, necrosis, vasculitis, embolic lesion, endothelial lesions. Tubulointerstitial necrosis, edema, interstitial inflammation, intertubular cast, and interstitial fibrosis. For the vascular lesion, this is an artery. In this renal biopsy, this is an artery, and it is noticed here for intimal fibrosis at this segment, while no fibrosis at the other side. This is fibroedematous vascular affection, and here is intimal fibrosis of this arterial section. This PS stain of this arterial section, here we notice hyaline vascular change at this segment. This small artery also affected by hyaline change. This is marked or obliterated artery by the hyaline change, more advanced stage, and this is early lesion, hyaline change. This is a TMA or thrombi of capillaries or small arteries of the kidney. This is example of vasculitis where the intima of this artery show vasculitis. This is another example of vasculitis. And this is also vasculitis with periarterial granulomatous reaction. This is fibrinoid change of the arterial wall. Here, the artery with smooth muscle layer is intact and appeared here. Here, the wall is changed for fibrinoid necrosis, and no smooth muscle or intact tissue are noticed. This is a small structure are called peritubular capillaries. These capillaries that are studied with marked inflammatory cells. So this is peritubular capillaritis. This section from allograft biopsy stained for C4D that is stained positive as a brown color. This is small capillaries are peritubular capillary, and this is stained brown. So this is C4D positive in a graft biopsy. And I thank you and welcome your question of any.